I'd like to start with family planning. So, Carolyn, wonderful to have you here. Can you explain a little bit about why it might be important to confirm your own genetic diagnosis and or that of your partner?
Yeah, so look, if you want to, consider having a genetic test in a pregnancy, or if you want to use IVF to conceive a child, it's actually really important first to identify the exact genetic spelling change that has caused your specific condition. So you really can't test a pregnancy or use IVF if the actual genetic change has not been identified in you first. In other words, we need to know what to look for in a pregnancy or when using IVF. So that's why we need to find out the actual genetic change in you first. So, and this is a bit difficult at times. Sometimes there can actually be, some uncertainty or some confusion regarding the actual condition that you have. And that's because there can be, overlap amongst a number of different kidney conditions, and the genetic cause can be different for different conditions. We've got 20,000 genes that make us who we are and what we are. And we know a few hundred of these genes can cause, kidney conditions. And so it can be difficult at times to know what is causing your condition and symptoms. And this is where genetic testing can sometimes help with this. Genetic testing can sometimes answer the questions of, well, why do I have this kidney condition and what has caused it?
Right.
So it's important to be as sure as possible as to what the condition is, so that you're provided with the correct information about how best to manage the condition in yourself, and to understand what testing options are available for family planning for you, including, what are the chances of passing this on to your children.
Understanding the genetic basis of your specific genetic kidney disease and understanding the inheritance pattern, how might that knowledge help you make informed choices when thinking about family planning?
Yeah, so look, knowing how the condition was inherited in you helps us understand the chance of your children being affected with the same condition. So if we know how it happened in you, we can then provide you with more precise information about what are the chances of passing it on to your children. And so for some conditions, the chance of passing it on to a child is about, is 1 in 2, a 50-50 chance of passing it on. And for other conditions, the chance is actually much lower and can depend on whether your partner, is perhaps a silent carrier of the same condition. So, and we know that, another factor is that, people's, perception of chance and of risk is a very individual thing, and really often depends on their own particular experience of, or knowledge of the condition in themselves or their family members.
So, when thinking about family planning, what would be the role of the genetic counsellor at this early stage?
Yeah, so there are many things that a genetic counsellor can help a family with, and some of these things are, providing you with an understanding about actually how genetic testing works. It's quite different to other standard tests. So we can go through all the ins and outs of how genetic testing works. We can discuss, the different types of outcomes that can arise from doing genetic testing. Things aren't always black and white, and there can be lots of grey. So we can go through what are the outcomes of testing. We can explain results in a way that it's easy to understand. We do try and leave out lots of the medical jargon and just try and give you the information in a way that you can process and understand. We can talk about, as I said earlier, about, helping you understand, well, what are the chances of passing the condition on to your children. We can provide you then with, options available for family planning, because there are many options, and we can go through those with you. We can offer, support around adjusting to a diagnosis in yourself or in your child. So, our role is very much about providing information, but as well, providing support as well. And, we can go through the pros and cons of genetic testing and sort of really help you make, the best decision for yourselves, because there is no right or wrong, and we can help you make that decision. We can help you understand, what your condition might mean for other people in your family, for your blood relatives, for example. And all in all, this support really is to provide you and your partner and your family with all the known information, specific to your kidney condition, so that you have all the information about, what are the chances of passing it on. And, knowing your options can be very empowering. Knowledge is power, and we're here to sort of help you make an informed decision that fits in with your own values and that of your family.
We have lots of families who invariably are affected by genetic kidney disease, or have some real concerns about their fertility or their chances of fertility. Where can families go to get more information about the choices that are available to them?
Yeah, so some people, certainly may wish to speak with a fertility doctor, a fertility specialist, as part of preparing for their family planning, to see if they have, any factors that might influence their ability to conceive naturally. And this information, may assist with, making decisions regarding the options moving forward for family planning, and may influence whether IVF might be required to assist with conceiving a baby. And, other people actually may already be aware that they have a history of infertility, and they can consider, genetic testing of embryos that are, made as part of the IVF process, to check if the embryos, have the genetic condition in question. This is called pre-implantation genetic diagnosis, and it can be used for lots of different genetic conditions, including, kidney genetic conditions. And that relies on, understanding and knowing the actual specific genetic change, as we talked earlier on in our discussion.
Wonderful. So for those interested in learning more about what are your options in family planning, we'd advise you to click onto the next video series.